Ontario midwives say there's growing interest in letting them perform abortions. The association, representing more than 800 midwives in Ontario, says there is a burgeoning interest in allowing them to offer abortion services. The idea was floated in recent months during discussions with the Ministry of the Attorney General and Health Ministry officials, while the Association of Ontario Midwives was offering advice on the recently passed Safe Access to Abortion Services Act, which prohibits protests within 50 meters of abortion clinics. Now the idea is on their radar, Elizabeth Brandeis, president of the association, said in an interview. The Association of Ontario Midwives has a pro-choice position, said Brandeis. We believe very strongly that reproductive rights, including a spectrum of choices around birthing, also encompass safe access to abortion care. Midwives do not currently provide abortions anywhere in Canada. In other parts of the world, they play a role, including in France, where they are allowed to prescribe and perform medical abortions. In Sweden, midwives can administer abortion medications, and they counsel women through the process. They can also prescribe contraception. In Canada, midwives are limited to providing care to women during pregnancy, labor and birth, as well as postnatal care for up to 6 weeks. There are more than 1,500 midwives working across the country. They go to school for 4 years to earn a degree in midwifery from one of 7 schools offering it, and then must meet the standards set by the College of Midwives in their province or territory. Brandeis said the continuity of care and a client-centered approach midwives already provide could easily translate into a model for the provision of abortions. Midwives could support women as they are making a decision about pregnancy termination, or if they have suffered a miscarriage and, as a result, need an abortion, she said. They could also support them through the procedure and provide post-abortion care. Right now, the system of abortion providers operates in silos, said Brandeis, and that's not helpful for women. The other main benefit to midwives providing abortions would be increased access to it, especially in rural and remote areas, she said. We know that the abortion system is fragile, she said. There are decreasing numbers of providers offering abortion, and so midwives being able to fill gaps within the healthcare system is something we are very interested in looking at, not just in abortion provision, but in many aspects of reproductive care. Abortion clinics exist mostly in urban centers, and women outside those areas largely rely on hospitals for the procedure. Fewer than 1 in 5 hospitals in Canada provide abortion, according to the Abortion Rights Coalition of Canada, and they can have long waiting lists or other restrictions, such as requiring a doctor's referral. The coalition says there is a shortage of doctors able and willing to provide abortion. Elizabeth Brandeis, head of the Association of Ontario Midwives, said her association has expressed an interest in providing abortion services to the government. Association of Ontario Midwives, Katrina Kilroy, a midwife in Toronto who heads the Canadian Association of Midwives, said there is interest among midwives across the country in providing abortion. This is not a contentious issue in the midwifery community, she said. Kilroy said it's well within a midwife's knowledge base to provide medical abortions by prescribing a medication that terminates pregnancy, and they could be trained to do manual vacuum aspirations, a type of surgical abortion. It would be a shame if governments didn't take the opportunity to allow midwives to provide abortion given the interest and the gaps in the system that need to be filled, she said. If there is an entire class of caregivers who could be offering that service, and they're not able to offer that service, that's a question for policymakers, said Kilroy. Ontario Health Minister Eric Hoskins, who was a physician before he was a politician, told CBC that the government has already been working with the Midwives Association to expand their scope of practice, which is set out in the Midwifery Act and is regulated by the College of Midwives of Ontario. The expansion includes ordering laboratory tests and prescribing more drugs that fall under the Controlled Drugs and Substances Act. Ontario Health Minister Eric Hoskins said the government is not currently considering the idea of allowing midwives to perform abortions. Daryl Dick, the Canadian Press, "We are not currently considering expanding the scope to include abortion services," said Hoskins. "This would require a significant amount of work, and although we are open to all discussions, it's not currently an activity that the ministry is undertaking." The health minister said he's not ruling it out.